In today's video, we'll discuss about focal epithelial hyperplasia. The definition goes as it is characterized by multiple papillary sessile areas of hyperplasia in oral mucosa. Now, this is caused due to human papilloma virus 16 and 34. Now, coming on to this is also present as a family trait. Coming on to the predisposing factors. In predisposing factors, what we see is it usually occurs in people who have low socioeconomic status, crowding in small rooms, malnutrition, also HIV infection, and poor hygiene. It occurs in association with HLA-DR4. Now, other names of focal epithelial hyperplasia are Hex disease, and it is also called as multifocal papillomavirus epithelial hyperplasia. Now, coming on to the epidemiology. In epidemiology, what we see is it usually occurs in adults and children. It is more common in females. Then site is very important. It occurs usually in the buccal, labial, and the lingual mucosa. However, it can also be seen in the gingival, posterior mucosa, and the tonsillar area. Now, in the clinical features, we will discuss. There are usually two types. The first one is the papillomatous, or yes, the papillomatous type, and the second one is the papillonodular type. The papillonodular type ranges from a color of pink to white, and the surface usually is flat with smooth surface papules, and it is more common. This is usually seen on the buccal, labial, and the lingual mucosa. Whereas the papillomatous area, it is usually white in color and the surface appears to be nodular, and it is seen on the surface of the tongue. This has a pebbly appearance. In clinical features, what we will see is there will be papules which will be present on the oral mucosa, which will give a cobblestone appearance. Now, after the clinical features, we will discuss about the histopathology. Now, over here, as any other HPV lesion, we will see that there will be presence of coelocytes. Coelocytes are also present in number of lesions like verruca vulgaris, condyloma acuminata, also squamous papilloma. So these become the differential diagnosis of Hex disease. Now you will also see hyperparakeratosis. Now the characteristic feature of Hex disease is acantholysis. Now due to this acantholysis, also what we see is the rete ridges, they become thickened and fused. That is, there is clubbing of rete ridges or the retipex, clubbing of retipex. After acantholysis and rete ridges, there is one more characteristic feature, that is the basal cell layer. It is bulbous and it has an increased mitotic activity. Now due to this increased mitotic activity, what happens is that the width, it increases. Now there is also one very characteristic cell which is present, which is a myxoid cell or a body. Now what are these? These are karyoretic bodies with variable amount of cytoplasm. So this covers the histopathology. Now coming on to the treatment. Now this lesion is usually self-limiting, that is it regresses itself, but however the lesion it can be removed for diagnostic purposes, aesthetic purposes, also when the lesions are subjected to trauma, recurrent trauma. There are certain methods by which this lesion can be removed. They are cryosurgery, cryotherapy, and so on. However, this is self-limiting and no such drugs are given. So this completes the Hex disease. Thanks for watching.